The prime procedure that's done in our office, surgical procedure, is that of a facelift. I like to call it a natural facelift. I want my patients not to be worried that they're going to look abnormal, they're going to look like somebody else. I want them to realize that the procedures that the facelift procedure we perform on them is going to keep them looking younger, more refreshed, and no one's going to say, oh my. We don't want them to create a tension, especially amongst the people who are close to them. We want the patient to feel totally comfortable at the end of this procedure. Also, by being able to do what we call a natural facelift, it avoids having to do extensive procedures which carry more risks and more downtime. So I always promote a natural appearance to the patient. So a facelift procedure does not have to involve many hours of surgery in the hospital under general anesthesia. By doing a procedure which is not extensive, one can do this under local anesthesia in my office. We have an operating suite which has full accreditation. The patient can take pills to get the sedation they need, or we can have an anesthesiologist give them conscious sedation, which is IV drugs. With the local anesthesia that we administer, these procedures are painless. The downtime for a facelift procedure is usually 1 week to 10 days. The patient, by the second week, the patient can be back at the workplace or back in society. If we add other procedures such as a iTuck or a blepharoplasty or a skin resurfacing type procedure for wrinkles, there may be a slightly longer downtime which would extend that period up to 2 weeks. The complication rate from these procedures are almost non-existent. One places the incisions around the ear in such a way that they're hidden, and the whole idea is to not leave any evidence on the patient that they have had a procedure once they have healed after 2 weeks. What's interesting about when does one do a procedure on a patient? When a patient's upset about how they look, no matter what their age, you offer them various procedures. You can offer them a non-surgical procedure or a surgical procedure. And if they want to get as much improvement as possible, and they are extremely concerned about their appearance, there's no reason why they shouldn't undergo a surgical procedure, which is of extremely low risk. When patients are younger and they only have slight laxity in the jowl and the neck area, one can offer them non-surgical skin tightening procedures. There's a whole host of new procedures out there which can get a 25-30% improvement in their appearance. Also delay the need for a facelift because the skin tightens, the condition of the skin improves, and that slows down the drooping effect that occurs as one ages. So non-surgical procedures are very useful for younger patients, but a patient can undergo a facelift procedure if they desire anytime from their late 30s, early 40s into their mid-80s. There's no problem doing these surgical procedures because the risk is so low and they can be done under local anesthesia. One can achieve dramatic results from a mild to moderate surgical procedure of a facelift. If one has prominent platysmal bands in the neck, then one has to approach the neck together with the face. Most of these facelift procedures involve lower face and neck. Rarely do we do a mid-face or upper facelift procedure. And the reason for that is because we perform fat injections and filler injections which give that fullness and lift to the mid and to the upper face. The facelift procedure, 99% of the time that I perform are done in my office. There's no need to have to go to the hospital unless the patient has medical issues. And the procedure done in the office with or without an anesthesiologist present can be very comfortable for the patient. These facelift procedures can be done very easily in the office under local anesthesia with or without an anesthesiologist administering conscious sedation. It's very easy to anesthetize locally the face and the neck area and give the patient a comfortable experience. Also, by being done in the office, there's less bureaucracy. Things can be done quickly. The personal contact with the nurses is excellent, and patients can go home. They do not have to spend a night in the hospital. They usually don't even need to have any nursing care that night. Family members can take care of them. So this is what happens most of the time with our facelift procedures performed in the office. The results that one can expect from this natural facelift procedure that I perform is one of a lifted lower face and neck area where the contour along the jawline as well as of the neck can be near perfect because of the technique that one uses. One tightens the underlying muscle as well as elevates the skin and removes excess skin around the ears, and this pull-up without having to dissect deeply into the face or do any complex type procedures can be quite effective. So patients most of the time can expect quite a dramatic result in the lower face. This also tends not to alter the sort of overall appearance of the face or change their true appearance. It's usually when one performs facelifting in the mid to upper face that the shape of the eyes changes, that one sees horizontal creasing of the wrinkles. But when one does a sort of lower facelift together with the neck, a very natural result occurs, and patients are surprised at the extent of the change that occurs without having to undergo too much suffering or discomfort.